I want to start with a scenario that plays out in homes across the country every single day. A caregiver notices that the person they're caring for, someone with Alzheimer's, is suddenly more confused than usual, more agitated, less like themselves, even accounting for the disease. Behavior that seems different, a change that feels significant but is hard to name. And the caregiver's first thought is almost always the same: the Alzheimer's is getting worse. Sometimes that's true. But here's what most caregivers don't know, and what the National Institute on Aging's guidance makes very clear. Sudden changes in behavior, increased confusion, or new agitation in a person with Alzheimer's are very often not the disease progressing. They're a signal that something else is wrong: a urinary tract infection, dehydration, a medication interaction, constipation, the flu. Medical problems that any person might develop, problems that a person without dementia would describe to you in words, can only show up in a person with Alzheimer's as behavioral change, because words are no longer reliably available to them. And if that behavioral change gets attributed to the Alzheimer's rather than investigated for a treatable cause, the person suffers unnecessarily, an infection goes untreated, dehydration worsens, a medication problem compounds. This is the gap I want to close today. Because knowing what to look for, and knowing when to call the doctor rather than accept a change as inevitable disease progression, that knowledge is among the most protective things a caregiver can have. Stay with me. Let's start with respiratory illness, because this is the category of medical problem that carries the highest immediate risk for people with Alzheimer's, and where prevention is both possible and critically important. Flu, pneumonia, COVID-19, and the common cold all share similar early symptoms: sore throat, stuffy nose, cough. For a person with Alzheimer's who cannot reliably communicate symptoms, these illnesses can progress significantly before they're recognized. And the consequences of respiratory illness in older adults with dementia are not minor. Pneumonia in particular is a serious and potentially life-threatening complication. It develops quickly. It can be triggered by something as seemingly routine as food or liquid that enters the lungs during swallowing, a risk we discussed in our previous video, and in a person who is already medically vulnerable, it can be fatal. The NIA's guidance on this is direct: keep vaccinations current. The flu vaccine, the COVID vaccine, and other recommended vaccines for older adults are among the most cost-effective health interventions available. They don't prevent illness with perfect certainty, but they meaningfully reduce the risk of severe disease and its complications. If the person with Alzheimer's shows any respiratory symptoms, even symptoms that seem mild, a healthcare provider visit or call is warranted, not to avoid overreacting, but because early treatment of respiratory illness in someone with Alzheimer's is far more effective than treatment of an advanced illness. Now let's talk about dehydration, because this is one of the most common and most under-recognized medical problems in people with Alzheimer's, and its effects on cognition and behavior can be dramatic. Here's where most caregivers get it wrong about hydration. They wait for the person to ask for water, or they offer water and accept it when the person declines, and they don't realize that a person with Alzheimer's may have lost the reliable ability to recognize or communicate thirst, meaning their body can be significantly dehydrated while showing no obvious thirst signal. The signs of dehydration to watch for include dry mouth, dizziness, a rapid heart rate, and, importantly, hallucinations. The NIA specifically notes that hallucinations in a person with Alzheimer's may be caused by dehydration, not just the disease itself. So if you observe what appears to be a hallucination, dehydration should be part of your differential thinking. What this means practically is that hydration has to be proactive and consistent, not reactive. Offering fluids regularly throughout the day, not just at mealtimes. If the person resists water, alternatives work just as well. Juice, flavored water, broth, milk, decaffeinated coffee, or tea. The goal is fluid intake, not any particular source of it. Talk to the person's doctor about how much fluid they should aim for daily, given their size and any medical conditions that might affect fluid balance. Let's talk about falls, because this is an area where Alzheimer's adds a specific and significant layer of risk that most people don't fully appreciate, even caregivers who know that fall prevention is important. We've talked in previous videos about falls as a general concern for older adults, and we've covered the importance of home environment modifications, strength training, and balance work. All of that applies here. But Alzheimer's introduces an additional dimension that changes the risk calculation considerably. People with Alzheimer's often experience changes in depth perception, the ability to judge how close or far away objects are. This isn't just a general visual impairment. It creates specific, predictable tripping hazards that wouldn't be hazards for someone without this perceptual change. Here's a concrete example the NIA provides. A change in floor surface, carpet transitioning to tile, may be perceived by a person with Alzheimer's as a step, not visually misinterpreted as a step in a subtle way, actually experienced as a step, clearly enough to cause them to stumble or trip while crossing it. This next detail changes everything about how you think about fall prevention for someone with Alzheimer's. The modifications that matter most aren't the same as for the general older adult population. They're targeted at the specific perceptual distortions that Alzheimer's creates. Transitions between floor types, changes in lighting that alter depth perception, shadows that can be misread as obstacles or holes. The NIA recommends consulting resources specifically on home modifications for fall prevention with Alzheimer's, adaptations that go beyond the general fall prevention advice and address these dementia-specific perceptual vulnerabilities. Now let's talk about medications, because this is an area of enormous daily complexity for Alzheimer's caregivers, and one where the stakes of getting things wrong are genuinely high. Most older adults take multiple medications. Add Alzheimer's to the picture, and the complexity of medication management multiplies. The person may no longer reliably remember whether they've taken a dose. They may be unable to distinguish between medications. They may resist taking medications. And the cognitive symptoms of the disease can make it almost impossible to identify when a medication side effect is creating new problems. The NIA's guidance on medication management starts with something that sounds basic but is genuinely important. Maintain a complete, current, written list of everything the person takes, not just prescription medications, every over-the-counter drug, every vitamin, every dietary supplement, every herbal remedy. This matters because interactions between these substances are common, can be significant, and are often invisible to any single prescribing doctor unless someone has brought the complete picture to the table. Caregivers are frequently the only person who knows the full medication picture. That makes them an essential part of medication safety. A weekly pill organizer, phone alerts, charts, calendars, timers, these are not excessive measures. They are the practical infrastructure of medication safety in a situation where the person themselves can no longer manage this reliably. Swallowing difficulties, which become more common as Alzheimer's progresses, add another layer of complexity. Some medications can be taken in liquid form, some pills can be crushed and mixed with food, but some cannot be altered without affecting how they work. Before making any modification to how medications are administered, check with the prescribing doctor or pharmacist. This is not optional verification, it's a safety necessity. And if you observe signs that a medication may be causing side effects, new confusion, behavioral changes, physical symptoms, bring it to the healthcare team immediately. Don't accept new symptoms as simply disease progression without investigation. Medication side effects in older adults frequently masquerade as other conditions. The team needs to know what you're seeing. We're now at the section of today's video that I told you was coming. And I want to be direct. This is the most practically important part of today's guide for people actively in this caregiving role. It's about incontinence. And I want to address it with the directness and respect it deserves, because this is one of the most challenging aspects of Alzheimer's caregiving, and one that caregivers are most likely to feel alone in managing. Most people with Alzheimer's will experience incontinence at some point. It can happen in any stage, but becomes more common as the disease progresses. And it can happen for reasons that are more nuanced than simply disease progression, reasons that a doctor can actually help address. This is the detail most caregivers don't know. Incontinence in a person with Alzheimer's is sometimes caused by a urinary tract infection, certain medications, an enlarged prostate, diabetes, or even caffeine intake. In these cases, the underlying cause can be treated. and treating it may significantly reduce or resolve the incontinence. Before accepting incontinence as simply a permanent feature of the disease, a doctor's evaluation is warranted. Ask specifically, could there be a treatable cause? When incontinence is an ongoing reality, the practical management strategies the NIA offers are specific and useful. Limit fluids after 6 p.m. if nighttime accidents are the primary problem, and offer fresh fruit rather than fluids if the person is thirsty at bedtime. Avoid caffeinated drinks entirely, as caffeine is a bladder irritant. Establish a bathroom schedule, reminding the person to go every 2 to 3 hours rather than waiting for them to signal a need they may no longer reliably feel. Make the bathroom easy to find and use. A large sign on the door that clearly says toilet or bathroom. Loose, easy to remove clothing. A stable toilet seat at a comfortable height. A colorful toilet seat that is visually distinct and clearly identifiable as what it is. Adult disposable briefs, washable bed protectors, and waterproof mattress covers reduce the physical burden of managing accidents. Careful skin cleaning and moisturizing after every incident protects against the irritation and infection risk that prolonged skin exposure to moisture creates. I want to name something directly here, because it matters. Incontinence is one of the aspects of Alzheimer's caregiving that most challenges caregiver dignity and emotional reserves. It's physically demanding and emotionally intimate in ways that can feel overwhelming. If you are managing this aspect of care and finding it particularly hard, please know that is a normal response to a genuinely difficult situation. It does not mean you're failing, it means you're human, and it means you need and deserve support. Let's spend a moment on dental health, because this is an area that often falls off the caregiving radar, and where neglect can have real consequences for comfort and overall health. As Alzheimer's progresses, helping the person maintain oral hygiene becomes increasingly the caregiver's responsibility. Regular dental checkups remain important, and regular monitoring between visits is equally so. The NIA directs caregivers to check the person's mouth regularly for sores, lumps, tooth decay, and food that may be pocketed in the cheek or on the roof of the mouth. Food pocketing, when food is collected and held in the mouth rather than swallowed, is a specific pattern that develops in some people with Alzheimer's and can create dental problems and choking risk if not addressed. Dental problems that go undetected are a source of pain that the person with Alzheimer's cannot clearly communicate. And as we've discussed, unaddressed pain in a person with Alzheimer's shows up as behavioral change, agitation, resistance, distress. Routine oral care and regular dental checkups are part of keeping the person comfortable. Finally, let's talk about doctor visits. Because managing medical care for a person with Alzheimer's means managing the visit itself, not just the appointment content. The NIA's practical guidance here is grounded in real-world caregiving experience. Schedule appointments during the time of day when the person is at their best. For many people with Alzheimer's, mornings are more lucid and less fatigued. Afternoon appointments often encounter a person who is tired, more confused, and more prone to agitation. Tell the office staff before the visit that the person has Alzheimer's. Most medical offices, when given this information in advance, will accommodate more smoothly, shorter wait times, quieter environments, staff who have been briefed. If doctor visits make the person with Alzheimer's anxious, which they often do, the NIA suggests not mentioning the appointment until the day of, or even right before leaving. For some people, days of anticipatory anxiety are worse than the visit itself. Knowing your person and calibrating the timing of that information to their specific temperament is part of thoughtful caregiving. Bring something familiar, a snack they like, an activity or object that brings comfort. A familiar item from home that can serve as an anchor during the unfamiliar experience of a medical office. And before every visit, prepare your own agenda. What changes have you observed since the last visit? What questions do you have? What concerns are you carrying that you want the clinical team to address? You are the person with the most complete picture of how this person is doing day to day. Come prepared to share it. Let's bring everything together with 5 practical actions. The first is to treat sudden behavioral or cognitive changes as a medical signal, not just disease progression. Increased confusion, new agitation, sudden withdrawal. These warrant investigation for a medical cause before they're accepted as inevitable. Dehydration, infection, medication side effects, dental pain, constipation. All of these can and do cause behavioral change in people with Alzheimer's. Call the healthcare team when you see something new. The second is to keep vaccinations current and treat respiratory symptoms promptly. Flu, COVID, and pneumonia vaccines are among the most important preventive measures for this population, and any respiratory symptoms, even mild ones, warrant a healthcare provider call or visit sooner rather than later. The third is to build proactive hydration into the daily routine. Offer fluids consistently throughout the day. Don't wait for the person to ask. Vary the options if water is refused. Know the signs of dehydration: dry mouth, dizziness, rapid heart rate, hallucinations, and act quickly if you see them. The fourth is to maintain a complete current medication list and bring it to every appointment. Include everything: prescription drugs, over-the-counter medications, vitamins, supplements, herbal products. Ask the team regularly whether any medications could be contributing to current symptoms. And never stop or modify a medication without checking with the prescribing provider first. And the fifth is to ask for help with incontinence management, both practically and emotionally. If you're managing incontinence, don't do it in isolation. Ask the doctor whether a treatable cause exists. Implement the practical strategies that make management more sustainable. And seek support for yourself, because this aspect of caregiving is among the most demanding, and you deserve acknowledgement for what you're carrying. Here's what I want you to take away from today. A person with Alzheimer's cannot reliably tell you when something is medically wrong. They can only show you, through behavioral change, through increased confusion, through distress that has no obvious verbal explanation. Your job as their caregiver is to be an attentive, informed observer who takes those signals seriously and brings them to the clinical team for evaluation. Most of the medical problems we've discussed today, respiratory illness, dehydration, medication side effects, incontinence with a treatable cause, are either preventable or addressable when caught early. They don't have to become serious crises, but they require someone who is paying attention and who knows what to look for. You are that person, and the knowledge you carry about what's normal for this individual, about what has changed, about the subtle signals that something is off, is irreplaceable clinical information. No doctor visits the home every day. You do. Your observation, your advocacy, and your willingness to keep learning what you need to know. These are not small contributions to this person's care. They are the core of it. Keep going. Keep asking questions. Keep calling the doctor when something doesn't feel right. And please, take care of yourself along the way. Before you go, here's something I want to plant for our next conversation. We've covered a great deal throughout this series, from nutrition and exercise, through brain health, through the full arc of Alzheimer's caregiving. But there's a topic that sits underneath almost everything we've discussed, and that rarely gets its own focused, honest exploration. It's about what it means to make genuinely good decisions about your own health and your own aging, not in the crisis moments when decisions are forced, but in the ordinary, uncrowded moments when you still have full capacity to choose. The conversations to have, the documents to prepare, the conversations with family that most people delay until they're no longer able to have them on their own terms. We'll explore that next, with the clarity and respect it deserves. If you want to be there, if you want to keep getting research-grounded, honest, practical guidance on aging with dignity and intention, subscribe to this channel. Take very good care of yourself. You are doing more than you know.